Currently, only 33% of Malaysians have enough EPF savings for their age. Yet, our government is asking us to withdraw from this insufficient savings to pay for our medical insurance premium. Let's talk about the most recent proposal by our government in solving Malaysia's healthcare crisis, which is to create a new medical and health insurance scheme to be paid for from our EPF savings. This doesn't make healthcare any more accessible or affordable. It just delays the pain. Already, only 33% of Malaysians meet basic EPF savings by age, and fewer than 20% at age 54 have the bare minimum for retirement. Middle-income Malaysians who receive little to no government aid are already struggling to save enough just to retire. If we start draining out our savings now, what will be left when we're old? Many will retire in poverty. With this proposal, it sure feels like the people are still the ones carrying the weight of rising medical costs. There is no promise of protections against rising premiums, only that we will have to find ways to pay. Anyhow, it is important to remember that this isn't an insurance problem. The problem is our healthcare system. Public sector takes up 50% of health expenditure, and public hospitals account for 68% of the total hospital admissions, which means a portion of the M40 and the whole of T20's healthcare needs are outsourced to the private sector. The majority of this group of people aren't rich. These are households with disposable incomes above 8,000 ringgit per month, which isn't enough to live comfortably with today's cost of living. Even if they are able to afford medical insurance, it doesn't mean that they should be draining out their savings to pay for overpriced private care. No government should have the right to push the people to the private healthcare system. It's unfair to coerce Malaysians to turn to the private sector just so there's more space for others in public system. It should be a choice of the people, not through compulsion. Instead of coming up with solutions that push the middle to upper income families to the private sector, the government should focus on what matters: increasing efficiency and capacity in the public healthcare system. To start, maybe it's time to look abroad, where a dual healthcare system has successfully made healthcare accessible for all. In the case of Singapore, where the quality of public healthcare is arguably higher. Creating a reliable public healthcare system is how we protect the average Malaysians from the never-ending spiral of private healthcare costs.